Hey, so today, this video is about cold sores, gingivitis, mouth infections, food related. Not just any food related. I'm going to tell you a few that actually affects me, like fruits. If I have a lot of apples, lime, lemon, apples. Actually, sorry, I just mentioned that. Apples, lime, lemon, oranges, tangerines, anything with citric acid, like a lot of citric acid in it. My gum would bleed. And if that's bleeding, a lot of people would say, oh, that's gingivitis. No, it has nothing to do with it. It's actually the citric acid is actually attacking your teeth, and it's pretty much the same thing here. Okay, now this past week, and also too, just before I go into the video, if you are not in a learning mode, this video is not for you, because this is a learning video, and this is also a how to stop it. Because there's no video to tell you how to do this thing very easily. And before I go into that, I'm going to show you something. Okay? And I wish I have that picture now. It's in one of my laptops somewhere, and I don't even know where my grandmother left that laptop. Yes, I don't know where it is. We have a lot of rooms in this house, and I don't know where it is. So I don't want to dig into her stuff, so I can't really show you the picture. Normally, I would just leave them on the screen right now, but since I cannot, I'm going to show you my finger. You see that? Okay, I'm going to leave it right there so you can see. Okay? If you look at this finger, that's normal. This is not normal. Why is that? It's because when I was like 10 years old, I cut off a tip of my finger through a lawnmower accident. And I have mentioned this in my other videos. I went to the doctor. They did not do anything. Okay. I was brought to the emergency room. That ride alone was almost $1,800. Yup, $1,800, and they did not do anything for me. Like I said, they did not do anything for me. They only gave me a tetanus shot because there was metal involved. Okay? That was it. They let me lay there in the emergency room for about 6 hours. Why I'm holding my hand like this. And a bandage wrapped around it. That's it. Okay? Just that's it. I'm holding like this for 6 hours laying in an emergency room. I could have been home. I could have saved my $1,800. So that was one lesson. 6 hours later, guess what they said? Oh, we can't help you. You have to go to a specialist. Okay. So they refer me to a specialist. Remind you, they did not do anything for me for the 6 hours. They let me lay there, and I knew that this would stop because your body will repair itself. Amazingly or not, please remember this and remember this video. What I tell you is your body will repair a lot of stuff naturally. Okay? Now, let me finish that story. So I went to a specialist. I asked him, I cannot feel this finger. And I cannot feel this finger. Are they connected? During that time, I was a kid. I know nothing. He said they are connected. And guess what he did? He took the bandage that they wrap around, put some things on top of it, put another bandage on, and it was hurting like crazy because the thing is already started healing already. And it was hurting crazy because he peeling that, when you get a cut or when you get a scrape or something, your body starts to repair. That repair, and little they know, they're supposed to be doctor here, okay? That repair was actually start to repair. They peel it back off again. Yep. Yes, they did. I am pissed. I was pissed. And it hurts like crazy. So then, Second time I went in, they did the same thing again. And guess what they charged those things were? Each visit was $450. So far, they got $900 out of me for doing nothing. Peeling off the thing, peeling off the Band-Aid, and put an ointment on. So 2 appointments so far. So I said, you know what? The HELL with this. Because I am not going to go through with this. I am not going to go through with this because they refuse to put anything on there. Because they didn't even gave me a shot or anything to take the Band-Aid off. And it was hurting like crazy. So I said, that is it. I am not going back again. I told my dad, I said, I will never, ever go back to that again. Even if I'm going to die. I'm not going back to him. He's like, so what are you going to do? I said, I'm going to heal this finger by myself. And that's, remind you, they did not do anything for me. All they did, in the hospital, in the emergency room, they just put a Band-Aid on. A bandage. They wrapped it around. The first visit with the specialist, he just took that off, put another one on. The second visit, he took that off, he put another one on. So I said, you know what? The hell with you all. So far, we, because my dad paid for it, about $2,000 in the hole. Actually, no. Almost $3,000, including the bandages, including all the ointments, including the Medicare, the Medicare thing, not Medicare, medical things. Like they gave me oxycodone, but in the really lowest dosage that they could. Because during that time was really like, I don't know, these pills that I'm taking, I don't even know if it's Oxycontin or whatever it is. I don't even know what it was. I kind of assume maybe it is. I haven't even checked my old records to see what they put in, what they gave me. But I remember they said we have to give him the lowest dosage because he's a kid. Well, it kind of helped a little bit. And then they said that because it might be drugs, I might be addicted to it, so they stopped. So I was in pain. Now remind you, I said enough is enough. So we're like $3,000 in the hole with bandages, with all this stuff. We are $3,000 in the hole. And they did not do anything for me. I said, okay, fine. I'm done. Guess what I did? These are my 2 Lifesavers. Neosporin and petroleum jelly. Okay? Yes. That's what saved my finger. Can you imagine? You got a whole tip of your finger, including the nail. The nail was actually gone. I'm glad it grew back though. But look at it. It's kind of messed up. It chopped off all the way up to here. Off. You can see it. How short it is. Okay? I'll hold it right there so you can see. Okay? So, I heal my fingers. Well, my finger. With just these right here. Yes. This lesson taught me 10 years ago. Well, actually, yeah, around there. Close to 10 years. 9, to be exact. 9 years ago. Petroleum jelly and Neosporin. And guess what Neosporin is? Close to that. And extra bacitracin. That's what they put in there. So, here's what I did. When I first put in, I said, you know, this somehow relieved my infections. But also help when you put bandage on. So, let's say if you had a big cut, put this on first or get Neosporin. So that way, it'll be less infections. Then wrap your Band-Aid or bandage, whatever it is on. And when you take it off, it's very easy to take off. So, concluded to this story. That's all I use. And that's how I heal my finger. Yup. For 3 months, that's all I used. I didn't go to the doctor or anything. So, I've learned a big lesson from that. And here comes the video here, because remember, this is a learning video, okay? Recently, well, not recently, I've been having this for a long time, and I know this for a long time, is that anything I have a lot of citric acid, my mouth, unfortunately, I won't show you my mouth, but my mouth and my teeth will get infections. Not infection, but it feels like, let's pretend this is my teeth. The gum would bleed. And the reason why for that is because the citric acid here is attacking. And here's another thing I've learned. Coca-Cola. I can guarantee you, if anybody wants to know what the formula in the Coca-Cola, there is apple syrup in here. Yes, you heard it correctly. Apple syrup and cinnamon. Those are the secret ingredients. I don't know how they do it, but I know there's apple syrup in there, because every time I drink that, I got bloody nose and my gum bleed. I was drinking this week because I'm doing something else for it. I'm actually making something else with these, and I'll go to another that video later. But I want to keep this video short. Anytime I have a lot of vinegar, I would have, my mouth would bleed. Apple cider vinegar or regular vinegar or salad dressing. Yes, I can't even eat regular salad, just to enjoy a salad. So, my gum was bleeding, and I can tell you offhand, a lot of people would say, oh, you have gingivitis. Well, guess what? My mouth is very healthy. Trust me. I brush it all the time. But like I stated, it has to do something with citric acid. For the people who is sensitive to citric acid, it will attack your gum. Okay, and that's what's happening with me. So, I remember my finger, but I can't use this in my mouth. So I use this. And yes, that's all you need. If you have gingivitis, if you have gum bleeding, if you have cold sores, if you have cuts in your mouth, anything to do with that, all you need is this right here. Yes, you heard it correctly. This is all you will need. And maybe hydrogen peroxide to rinse it, you know, just to get disinfecting. Also too, this is for dogs and cats, and they're very cheap. It's a gel. It's a cobble gel. And I'll show you in a minute what it does. Yes, this is for dog and cat. But yes, you can use this for yourself. I've been experimenting this too, and it helped a lot. But if you don't want to, no worries. This is your answer right here. Okay? Now, remember my finger. You will remember this video. Remember this. I healed it by myself. And yes, it's been cut. Look at that. Show you one more time how cut it is. Okay? Meaning, I had a tip of my finger fall off. I can actually see it. I still see it now and then. Anyway, I'm going to show you how to do it. And it's very easy. And oh, before I show you how to do it, I'm going to tell you why. The reason why for that is that Vaseline, when you rub on things, water, it's protection from water. That's what it is. So water cannot get through this. So what happened? It's able to heal. So if you have cold sores, remember this. Cold sore, bleeding gum, gingivitis. With gingivitis, I want to tell you something first, okay? Gingivitis it's a little bit harder to treat, but you can treat this on your own, and I'll tell you right now. I'll show you how to treat that, because my grandmother had it and I did it. And I waited a long time for this video. She had to brush it 3 times a day. Remember, this is for gingivitis. You have to brush it 3 times a day with a good toothpaste, with some kind of fluoride toothpaste. And if you have a electric toothbrush, it has to be the softest one that you can handle. And you have to, let's say this is your teeth, because we're going to make, this is our teeth, okay? This is your teeth and this is your gum. You have to use the bristle and massage all this area right here. If you see any tartar, if you see any junk on there and stuff, you need to get all those out. Okay? After that, when you're done, you take Vaseline. Our secret. I'm going to call this our secret. Put it on your gum. Massage the whole mouth. Just like that. Make sure it's dry. Your whole mouth is dry before you do this. Okay? You want to massage this right at your teeth. Right here. What does this do? It protects. It acts as a protection so it can heal. Okay? So anyone who have issue with citric acid or anything that I mention here. 1, you have to eat less. 2, you try to eat this less or drink that less. 2, avoid them, period. But for the people who can't avoid them, you know how to treat something like this here. And most of the time, they think it's gingivitis. But it's actually not gingivitis, because my case is not gingivitis because my teeth are clean. I clean them. I'm a clean freak. You will know my videos. I'm a clean freak. Okay. And if you've seen some of my video, I mentioned that a lot. I'm a clean freak. I'm a germ freak. Anyway, so that's what you would do. Okay? So you would massage it. And you leave it for a little while. Don't close your mouth, but massage it with just a 2. This is your secret right here. What does this do? It prevents liquid or your spit from going into attack. And before you go to sleep, during your treatment, before you go to sleep, you have to do this, or else the bacteria inside your body to come out, and it's going to reinfect that again. So it's very crucial, okay? If you want to save money, you need to follow this video. And you can trust me, you will save a lot of money because there is no video like this out there. I can assure you that. And probably dentists gonna hate this video, but I don't care because like I stated, I have healed this by myself. So that's all you need, and that's your weapon right there. And here's another thing. Because of this, I bought this for my dog. I tested out, and yes, it worked. It also removed plaque and tartar too. So literally, just go to the store and get this. It's like $10. You can treat gingivitis with this. Because it will help to remove it. But I don't have any. I just experimenting. But it works. Okay, just to let you know that one. And it's minty fresh too. So there's 2 things that you can get from the store. But like I stated, this is your secret right here. Petroleum jelly. That's your secret. Now, before I go, if you have cuts, if you have cold sores, if you have gingivitis, if you have bleeding gums, if you have teeth or gum hurting, you can do this after you brush. Remember, it has to be brushed 3 times a day. That first week, the first week that you're starting to have this problem, that is very crucial because we need time to heal. And this will help us to heal faster. Yes. Petroleum jelly will help you heal faster. Because I heal my whole finger with no doctors, none whatsoever. And that's how I did it. I kept my finger like this. I'm going to demonstrate really quick. It will work for cuts. It will work for wounds. It will work for everything. Because, let's say if I have a cut here and I put some on here. You can go and bathe. Or take a bath. or showers because the water will bounce right off. That's what I learned from this. So what I did was, because I cannot touch that area is sensitive, here's what I did. I put it right here, all around here, anywhere that I am able to touch, okay? Then I waited until it get really hot. When it gets hot, what happened? Petroleum or vaselines or whatever it is will melt. And then it starts to coat all around here. Once it's starting to coat all around here, I go into a shower and I take a shower. And that's what I did, how to take a shower without getting reinfected. Before that, I used Neosporin. Neosporin is cheap. For one visit, remember, one visit, they charged me $450. This is only $5. I could have get 100 of these. So what I did is I literally, every time I remove my bandage, I use half of it. I didn't care. I told my dad, I said, okay, this costs almost $5. It's less than me going to a doctor. And he was hurting me. So half of this is only $2.50. Hey, it's $2.50. It's better than $450, don't you think? Well, that's what I did. Amazingly as that. That's what saved my finger. And no, I'm not advertising for them. But for your mouth, this will save you. Right here. That's all you need. And like I stated, I'll state it one more time. Cut. Cold sore. Gingivitis. Bleeding gums. Anything to do with gums, sensitive gums, or anything like that. Food related. Or, like I stated, fruit related. Like I said, if I eat oranges, lime, lemon, tangerines, apples, any of that nature, because there's too much citric acid. And somehow citric acid attack your gum. And yes, you heard it all the time. You will hear this all the time. That it will attack your gums and it will attack your teeth. And that's what I've learned. And it's the most amazing thing in this lifetime so far is right here. And it's cheap. And it's cheaper than going to a doctor. Can you imagine? Can you imagine? Each visit would have cost me $450. I don't even know how many visits I would have to do before this finger was supposed to be healed. Can you imagine? Every single time I go there, it's $450. And yes, my dad paid cash for them every time we went in. So, because during that time, he didn't have any insurance. So it didn't really cover me or anything. We had no insurance. So we paid out of our pocket. But I learned my lesson. That was a $3,000 lesson. Ha 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 ha. Now you guys are getting it for free. So that's what I did with my finger. And see how it's dripping? It's dripping down because I leave it like this. Because I couldn't touch. Remember, I can't touch down there. So, one more time before I go. All you have to do is take some. Pretend this is my teeth and this is my gum. My nail is my teeth and this is my gum. All you have to do is massage it with that on that. And make sure you brush before you do. And this applied to cut, this applied to wounds, this applied to, like, let's say if a kid scraping on the cement or whatever it is. So scrapes, cuts, wounds, and everything. But wash it first, okay? Disinfect it first. And then from there, use this. But if it's cut, this is for your mouth. If it's cut, just get Neosporin. And no, I'm not sponsored for them or anything. They saved me, that's for sure. Take a little bit and just put it on there and wet it. So that way, it will be nice and it have like a coating on it. That way, you can splatter on it, you can do whatever, and it won't get yourself reinfected or infected. Okay? And that's how I heal this finger. Can you imagine? I heal this finger. And yes, it was the biggest cut in my entire life. Whew, that was not fun. I still have nightmare now and then. But this is what saved me. And this is what saved me too. Okay? So, since you cannot put this in your mouth, I do not advise you to put it in your mouth. If it's mouth related, you need this right here. Put it out in your mouth or go to a pet store or whatever and get one of these for dental for dogs and cat. And yes, it will work for a human too. And it's only $10. $10 is better than going to a doctor or a dentist, wouldn't you think? But don't take my words for it. If it's severe, you need to go to the dentist. But if it's non-severe, remember, before I go on this video, and I'll say one more time, this is for non-severe infections. Gingivitis, you might have to look at it first, okay? So pay attention to it first. For 2 weeks it doesn't work, that means it's not working for you, okay? Other than that, it'll work for cuts, whatever. I'll list it in the description too. Other than that, that's about it. And I will see you in the next video, okay?